in my work, I've been in this for 40 years as of February. I didn't want to do this work. I was in seminary, I was interested in ministry and administration, and my advisor said you have to have some administrative experience if you're going to be get a doctorate in ministry and management. And I said, well, where do I get that? And they said, well, there's a place called Wesley Woods. It's right down the street from Emory. They have an administrative internship program. And I said, you've got to be kidding. You're going to send me down to that place? My mother was one of the founding volunteers, and we used to threaten my grandmother with it. My grandmother lived with us half the year, and we had a little house, and Mother and Daddy both worked. And when I'd get home from school, Mama Roberts would be watching the soap operas and divorce court, and she thought she'd say, "Lord, how people do, son." Divorce court was particularly important to it, but we'd say, "Mama Roberts, if you don't behave, we're going to send you to Wesley Woods." And now I've got my advisor saying, "You got to go down there," and I said, "Please don't do that to me." And he said, "You have no choice." I walked in down there on a snow and ice day to start my internship. I had a briefcase with nothing in it. I showed up in our nursing home. I'd been working in a psychiatric hospital. I was a psychiatric assistant for 5 years on the evening and night shift, so I was familiar with health care and helping people that were facing difficult circumstances. And I loved mental health work, and I thought that that's probably what I would wind up doing. And truth is, it is. That's all I'm going to say about that. At any rate, I showed up, and the staff put me to work doing basic care because there was a shortage of staff. And I've loved every day of it. My mother moved into Wesley Woods, called me several months after my daddy died, and asked me to come over. She had something to talk to me about. It sounded pretty serious. And she said, "I've decided to move into Wesley Woods." It was one of the first HUD 202 programs in the country, and the first round building in our field, and among one of the first round buildings of most any kind in the country. They had just the apartment she wanted, and she said, "I'm moving in." I said, "Well, I didn't know. I was president of it at the time, and I had no idea." She said, "Yep, they got just what I wanted, and I'm going to go, and just wanted you to be aware." All right, well, that's your decision. I thought to myself, man, if the administrator there is willing to take you, you become partly her problem and not just my problem. My mother was a very competent, she was a steel magnolias, fried green tomatoes sort of girl. And it didn't take her any time to become head of the loyal opposition party to the administration. And as I thought about that over the years, there are different kinds of mentors, and this is the kind of mentor Charlie is. As I've gotten to know resident leaders, our whole field is moving from a paternalistic, maternalistic approach to resident relations. You got to remember that many of our members, average lifespan of our members is 75 years. Some of them go back nearly 200 years. After the Civil War, our members created widows and orphans homes. We have homes for old women and widows of veterans of the Civil War. You talk about a fancy name. We had the Christian Insane Asylum in New Jersey. Think about that. We have the Home for Indigent Old Men of Good Character in Boston. We don't know where the women went, or the rich men of good character, or the rich men of bad, we don't know, but those were the kind of names, and over time it developed into, how many of you remember the rest homes? Every county, especially in Georgia, we had family that was in the rest home. But then by the 60s, the Home for the Aged was coming in. And in the new era, my predecessor and mentor and the guy that hired me into this field, the late Scott Houston, became president of AHA, and he introduced the first resident component of the annual meeting. And I remember resident leaders like Henry Sossaman. He was the resident leader of our intermediate care facility, and it reminds me so much of you Charlie. And then there was Pat Patterson and Agnes Spivey. She was the queen mother of Wesley Woods for years. And we would always take a delegation to the annual meeting. And then at the national level, Charlie, you and Ruth and Marlene are the national examples. And what a great example you have set, Charlie. And the signal of how do we begin to do things with you and not just for you is the era we're entering in. And we don't know our own strength when it comes to advocacy if we begin to get on the same page about public policy in this country. Do you remember what you were doing in 1958? Mm-hmm. Do you? I was 11 years old. We had just bought our first little house outside of Decatur, Georgia. My new school opened up, elementary school. Miss Arnold was my 6th grade teacher. And I came home every day complaining about Miss Arnold. And my mother, as wise as she was, said one day, she said, you know, I'm going to take off work tomorrow and I'm going to take you to school and we're going up there and we're going to have a little set to with Miss Arnold. And I'm thinking, yeah, that's what I need, boy. Miss Arnold's been mean to me. And then she says, yes, sir, we're going to get some things straightened out because Miss Arnold's not going to treat you like that. And I said, no, that's really good. And then I got thinking about it closer to bedtime. I said, do I want my mother taking me up to school in front of all my friends chewing out Miss Arnold? And I began to think about, well, now, Miss Arnold, I got to be with her the rest of the year. And I spent the rest of the night in the early part of the next morning talking my mother out of going to see Miss Arnold. My mother never intended to go, but man, she had me believing that I decided I could work things out with Miss Arnold. But I was on the Giants Little League team in 1958. And we were part of Belvedere Methodist Church, was just getting off the ground, and among the early families there. But let me tell you what else happened in 1958 as we're thinking about founders. At a hearing on Capitol Hill, a Senator Sparkman from Alabama, was holding hearings about this new emerging aging population and the implications it had for our society. Now, this was before Medicare, Medicaid, HUD, CCRCs, tax-exempt status, Meals on Wheels. And he said after a proprietary administrator testified at this hearing, Senator Sparkman said, where are the church-sponsored and nonprofit homes on these issues? We didn't have an answer. There was a deafening silence. That prompted some of our leaders who'd been doing innovative things throughout the country, many of them for generations, got together on the banks of the Hudson River at a place called Arden House to discuss whether or not there was a need for a national nonprofit association. They planned their meetings well. They commissioned a paper by a Dr. Robert Morris from Brandeis. And he used the concept of what the horizon holds for aging in America. And I want to read some of that and see if it makes some sense. He said, we have to recognize the strength of the winds of change generated by a rapidly growing aging population. There was a frank recognition, he said, that social institutions must change as well. Because the prevailing concept, progressive concept, was the home for the aged. The first horizon he listed was exploring the recognition that the very great increase in the absolute and proportionate numbers of older people will make it impossible for society to rely upon institutional care as the primary method of meeting needs. Therefore, the sector must plan for services to be delivered in private residences to include more decent elderly housing at low cost, and the nonprofit sector would be called on to experiment in imaginative ways to bring community health programs into the homes of the elderly wherever they reside, along with the emphasis on teaching self-care. That was introduced in 1961. The second horizon was driven by changes in mortality and morbidity. He said we would have the conquest of many acute illnesses, and yet we would produce more people that would live longer with disabilities, especially mental disabilities. At the time, I bet few people in the country would have known or ever heard of Alzheimer's disease. But what we called it, I remember driving through Greenville, Georgia, and seeing my Uncle Doug just wandering in the road. It was senility or hardening the arteries or whatever, but we know that that need is growing, and if you live to be 85, there's a 50-50 chance you will develop dementia. What are we going to do about those issues? And with a cure not at hand, the emphasis for us is how do we improve management of those. And the Arden House people said it was clear that the majority of those institutionalized suffered from mental problems, but the role of environment, staff training, and professional interventions would be a priority for us in a place that looks very familiar, like home. Think about that. Another horizon would we become more and more related to the medical care system. General hospitals, they said, and I quote, retain chronically ill and elderly patients long beyond the necessary period, or they discharge them to very poor home environments. That is exactly what's too expensive about healthcare today, is that we're not managing those transitions from hospital to home to help people cope, and therefore you see bounce back. They prophesied those issues. They said there would be a vast extension of Social Security in many forms. Social Security was fairly new, didn't cover even everybody at the time, but people would have more money and would demand choices. And yet there would be a group of vulnerable people, especially women, that we would have a responsibility to provide for over time. And there would be an urgent need for data collection and evaluation around things at work. They envision multi-purpose centers for the aged, which took responsibility for many other services to the elderly outside of an institution, a center under a unique single administration that can assemble the staff, the skill, and the facilities for a wide range of services to elderly persons throughout the community. What is the CCRC today, if not that? Think about the prophetic vision that these people have, beginning in 1958. So here we are today. We have low-income housing. There's too little of it. The government's cutting it back, and it's one of the best investments in people's health and well-being that we've had since the Great Society programs were implemented. In fact, we're beginning to see that people that can be maintained in low-income senior housing projects, whether they be 202 or public housing or tax credit, when you can orchestrate and coordinate services, they stay out of hospitals and emergency rooms. Think about that. And there are 11 people on a waiting list for every unit occupied. So cutting back on things that work is not the strategy. Think about today's outreach programs, Meals on Wheels, adult day programs, senior centers, home and community-based programs like attendant care in the home, not medical services, but those are now in place in every community but rationed. And we're cutting back on them. If you cut back on Meals on Wheels, that's exactly the ticket for many people to the emergency room. It triggers the most expensive response to lack of a meal you can have, and it's called 911. So we have all the things in place. We've had visionary people like this that have implemented them, but we've got to make sure that that these services are not only preserved, but expanded and better coordinated. So our job is not done. We need to work on these things together. When Susan Weiss will tell you, when we walk into a member of Congress or senator's office, it makes all the difference in the world if they know you have wanted us to come and follow up. Because you vote and vote for them. We have to get beyond petty politics and ideology and self-protection. Because I promise you, some of the rhetoric, we had members visit some of our members visit a member of Congress at our recent peak event, and he said, all of these government programs for the aged need to be shut down. That's the role of families. Now tell me, how many of you have had someone in your family with Alzheimer's disease, and you know you got to the point that you could not cope with it at home anymore? Can I see that show of hands? Of course. So what do you do with people like that? Say, good luck, family? No. What is our responsibility together, morally, for people who are most vulnerable? Do you know who the #1 funder of long-term care is in the country today? Social Security? Any other guesses? No, it's families' pocketbooks. It's families, it's not Medicaid. It's families' pocketbooks. So how do we begin to look at how we're already paying for things and do a better job of it? That's the vision ahead of us over the next 25 years. And if we don't do that, your grandchild, who was my age at 1958 when we started, is going to be saddled with more than we can burden them with. And it's not because of our reluctance to cut back on this, that, or the other. It will be that we have not been imaginative enough to take the resources we have in this country and use them through better stewardship. We don't have an imagination problem in this country. We don't have an entrepreneurial problem. We don't have a resource problem. We're spending more than twice on healthcare of any other industrialized country in the world, and our healthcare outcomes are just above Cuba's. Now think about that. Think about that. So, no, we have a political leadership problem in this country. And I'll conclude with a question that the Arden House people asked themselves through this paper by Dr. Morris. He said the real issue is this: can we be sufficiently flexible and imaginative to develop requisite programs and services, or will we be too fettered by rigid concepts of the past? So as we look at this era of the next level you're taking NaCCRA, which vision Charlie put right out. One of the things I like about Charlie is I don't care what kind of shape he's in and what he's encountered in the way of health, he's always talking about his vision for the future. He ain't complaining about aches and pains and grumbles and groans, and he's talking about the future. And that's one of the things that I admire most about you, Charlie, as a role model. We have to keep talking about those things and not be fettered by our own rigid biases, politics, whichever news channel you watch, whatever. But you know what I found the equalizer is in visiting with Congress? Whether somebody's had a mother or a father with Alzheimer's disease. Then all of a sudden, the conversation changes. If they haven't had experience with that, they can be polarized on one side or the other around these arguments. We have to keep it real and make it real for the policymakers. And if we make policy in partnership with you, we'll transform this country's approach to preparing for a healthier aging society. That our 11-year-old kids can be supported in, because I can tell you that 50 years ago went that fast for me, and I bet it did for you. Thank you. God bless, and don't you forget, I'm from Washington, and I'm here to help you. Thank you, Charlie. Thank you.
Thank you so much, Larry. And are there any questions that you might like? Larry said he had a few minutes, he could do that. I know he's got to catch a plane, but.
Any questions? Yes, ma'am.
Is the association,
I'll repeat the question. Go ahead.
is LeadingAge doing anything to increase voting representation of members on boards?
Yes, we have been supporting that, and one of the issues we talked about last night with some of your board members, we have to be more organized and intentional about resident representation throughout our membership. We have some people that take a very conservative view of that, as you well know, and some that have had residents that have been chair of their boards. And so one of the things we want to do is begin to show good examples, and how do we model that at the national level? We've had a good relationship with you that's been based on the goodwill and informality, and we're trying to figure out how we do more of a partnership model with you, not just programs that people can say, you know, here's what we've done, here's how we've done it, and you know, none of us have died from it. when you think about it, but it's that shift from the maternalism of the past to partnership. Now, what makes that difficult is adversarial attitudes on both sides. And people get stuck in a rigid adversarial thing, and then we got to somehow get people beyond that. But, you know, we've got that in Congress. Our whole political climate nationally today tends to pigeonhole people immediately. I'll bet you can take some of my comments and put a label on me just that quick. But we got to get beyond that. So we're going to work hard at that. It's a great question. That's at the heart of what we're trying to do. Yeah. Are there other questions? Yes, sir.
I can't disagree with anything you said.
He can't disagree with anything we said. Thank you very much. Are there other questions?
How do we pay for it?
How do we pay for it? If you look at some of the question is, how do we pay for what we do? If you look at it now, and we've got a task force we have put together of national experts and some of our own experts on what we're paying for with all sources long-term care, I can promise you it'll blow you away. What we're already paying, if you step back and say, how can we spend it differently? We know, for example, there are a number of different programs in the healthcare bill that are set up to be pilots and demonstrations that can help people stay at home at less cost, keep them out of hospitals, and the early returns on some of those programs is that they're working. There is no question in my mind we can spend the money differently and get a better result quality-wise at less cost. And I think the next few years we're into a lot of that kind of experimentation. Now, what governors are facing is Medicaid managed care. States are galloping toward Medicaid managed care. The danger there is that it becomes Medicaid managed cost, and they forget about the care. And so we're working with our states on the design of these Medicaid managed care programs and the federal government around the design of these Medicaid managed care programs, because the most cost is spent on the dually eligible Medicare, Medicaid. Those are the poorest people that are the most vulnerable, that are the sickest. That's where most of the money's going. The irony is, the better job we take care of poor people, the better health care is going to be overall, and the lower the cost. And that's sort of counterintuitive. The prevailing sort of political wisdom is we got to cut back on those people. But we need to focus more attention. There have been some really good articles about that recently around even individuals that soak up hundreds of thousands of dollars a year, bouncing back and forth to the hospital when they can be managed in home settings by redesigning how the delivery is done. So I'm convinced the money is there. Do we have the political will back off of some of our attitudes about that and change it. That's what that's what the country's fighting about right now, actually. It's a great question. Are there other questions? Yes, sir.
Has there ever been any relationship established on the historical aspect of APRA, American Association of Retired People?
We have a good, the question is, what kind of relationship or rapport do we have with AARP? The relationship has been good over the years. We have worked on certain things that we've been together on, but we don't have a formal type relationship with them. One of the things that we would like to do with you, because different consumer, I call you a consumer type group. That may not be the right label, but you're a consumer group. Consumer groups come to us all the time and say, can we have a relationship? Can we do this? There's the Alliance for Caregiving, and there's Alzheimer's consumer groups. There are MS, ALS consumer groups. We would like to have a way to understand at any given point in time how the people we serve stand on certain issues. AARP notwithstanding, because you are our primary, we are a 501c3 organization, and going back to our founding documents, it says we're a membership of nonprofit organizations that exist for the benefit of the people we serve. And we've never harnessed that for the benefit of the people we serve. And so we'd like to find a way to say, here are our consumers. By the way, our members serve 4.5 million people every year. That's a lot of people. We employ about 1 million, and we think the volunteers are into the hundreds of thousands. We did an estimate one time, there are probably somewhere between 70 and 80,000 volunteers on boards of directors. And these are the people whose voices, your voice and board's voice, are the ones that don't get heard enough. You give me a credible board chair, a nun, a resident, and a direct care worker, and we can change the world. Especially with a nun. One last question, maybe? Did that answer your question?
Well, it comes to mind that there's a lot of power in ARP.
Yes.
They have membership. They are a 501c3 like you suggested. But it would seem to me that I would hope that NaCCRA board has a relationship being established with ARP.
You would be wise to do so, and I'd love to go to AARP together with you and say, what more can we do together?
Thank you.
Yeah. One last question, anybody? Yes, sir.
Just a comment. We had a speech by the CEO of our mission hospital in Nashville, the major hospital there. He said that 75% of the people who come to that hospital can't pay their bills. The bills at the hospital are paid by 25% of the people that come there. And I think that fills in some of the things you've been saying.
Yeah, the question is who pays the bill in hospitals, and they're 25% of the bills are paid. It's like almost like churches and synagogues. 20% of the people put up 80% of the money, and what the Health Care Act was not designed to do is, and the reason hospital association and we supported it. One reason is that it brought more people insured. Hospitals are having to pick up uninsured costs, and believe it or not, we have members that wind up getting uninsured people to come to them. And so we have a charitable load with Medicaid costs that are not covered, as well as there are people that don't have coverage. Believe it or not, there are people that do not have coverage in this country, and we tend to think of everybody having coverage. One of the things that is wrong with the current system is that consumers don't know what they're paying. I have a cousin, Bubba. I really do have a cousin, Bubba. I'm from the South. I got more cousins with initials. I've got GD and JC and DR and BH and Bubba, and I've got Bobby Sue. I also have a cousin named Frog. So enough of the family tree. But Bubba is my second oldest living relative. He's like an older brother to me. He's 86, and he lives in Kennesaw, Georgia. Doesn't get much more conservative politically than Kennesaw, Georgia. It's the only municipality in the country that has a law in the books that you must own guns. And Bubba was an engineer. He was a real engineer, the kind that drove a train. Not a hair on his head. I see some similar hairstyles in the room. Has only one eye and a horse that could read his mind until the horse died in the middle of the pasture. And if you call Bubba, he can tell you what's wrong with health care. And I get that earful periodically when I say, "How you doing, Bubba?" "Well, son, how are things in Washington?" And then he'll proceed to tell me how things are in Washington. But he had 2 stents put in. And I called him to ask him how he's doing. "Well, homie," he said, "they kept me overnight in what they call the ICU." He said, "The CEO of the hospital came by to see me." He said, "I read the pay. They're paying that boy $1 million. Woo, he sure was friendly. He was nice to me. And I said, "Well, what about your heart, Bubba?" And he said, "Well, I don't," he said, "I reckon I'm doing all right." I said, "What did the doctor tell you?" He said, "I didn't see no doctor. I go to see the doctor next week." Now, see, that's part of the generation that don't ask a lot of questions. You just do what they tell you. And he said, "So I go back next week. I reckon they'll tell me they did 2 of them things they said they was going to do." And he said, "I was in there 18 hours. And he says, "And I'm glad you called today because I just got the bill." I said, "Really? What is it, Bubba?" And he said, "It's $101,082. He said it 4 times, $101,000, and emphasized 82 cents. And he said, "That's what's wrong with health care." He says, who's paying that?" He said, "I ain't paying it. I don't have that kind of money. They could take everything I got and they wouldn't be able to pay that." He said, "But somebody paying that, right?" And I said, "Bubba, I love you like a brother." And his wife, Rachel, is a saint. I said, "Bubba, I love you like a brother, but as a taxpayer, I don't think you're worth $101,082. I said, "Now Rachel is." He starts laughing, He said, "Guess what Larry just said, Rachel?" He said, "I ain't worth it, but you are." Anyhow, he doesn't understand. He thought that was a bill. That's a trumped up thing, the way hospitals have to do it. Nobody's recognizing the real cost of health care. So we're all kind of fooling ourselves about it based on the complicated mechanics that we've been talking about of how people charge for things. And he doesn't know to this day. He knows Medicare paid something. He probably got a statement back. But I guarantee you, whatever they did wasn't $101,082, but he thought that's what the bill was and was concerned somebody's going to come after him to pay for some of that. So he said, "That's what's wrong with health care, son." And I said, "Bubba, you're absolutely right. Those are some of the kind of changes that we have to speak up as consumers and say this has to change. Because we can do a better job for less if we speak up, or we just let it." I got interviewed on a radio talk show once in the middle of the healthcare reform. This woman called up, and she was against everything going on in the healthcare thing. And I asked her why she got her healthcare, and she was on Medicare and Medicaid. And she said, "I just don't want the government messing with my health care." I said, "Okay, well then, there's a grasp of the reality of it." So you're a sophisticated, smart, active bunch, and people listen to you. A lot of the people that are getting health care don't have a voice. And you've got to be their voice, not just your own voice about all these things. And so that's part of what I believe, one of the responsibilities we have together is to be a voice for the public good. However we might disagree about the details, I guarantee you everybody in this room's got a heart of gold. We heard a pollster and a message expert, Frank Luntz, who's a Republican message expert. He met with a bunch of our CEOs about messages. He wrote a book called Words at Work. He's a genius. He's a bit of a odd duck kind of guy, wears colorful tennis shoes and got a rug that sticks out all over the place, but he's brilliant. And he took a number of annual reports and things of our members and gave them feedback on messages in there that connect with the public. It's really good. And he said, Democrats and Republicans alike in polls are against welfare. Republicans are more against it than Democrats. A higher percentage of both are for helping the poor. Think about that. It's all a matter of how we begin to say what the agenda is. And I'll bet you everybody, if I'd asked that question, I bet you nearly every hand would have gone up. If genuinely poor people, you'd want to help them. But we don't like the welfare state. No, of course we don't. So you see our challenge together is common ground about goals and messages. And then the next challenge is how do we organize advocacy? The NRA can generate 100,000 cards and letters and phone calls in 24 hours. I'm not getting into the politics of gun control, that's not my purpose. When Susan started our grassroots campaign 15 years ago, we were proud of 300 cards and letters, right, Susan? And we got it up to 10,000 summer before last with 4 million people that we serve. So, when do we get up to? Can you imagine what your voice on a given issue could do if we all spoke at once? That's the power of partnership together and the voice of the consumer. So thank you. I've spent far too long. I'm Charlie Paulk-esque. My 5 minutes is up. Charlie, you deserve all the accolades you get, my friend. And Ruth, thank you, and Marlene and Bob and others for the great job you do.
Thank you.